In the far south of one of the world's most densely populated countries, the world's biggest refugee camp, crammed with over 1 million Rohingya Muslims who fled ethnic cleansing in next-door Burma. Many live 12 or more to a room in bamboo and plastic shacks, a density 4 times that of high-rise New York City. Prime conditions for corona, which thrives in confined spaces, threatening to turn crisis into catastrophe. Loudspeakers mounted on auto rickshaws broadcast COVID-19 warnings and public health advice. Mobile networks and the internet have long been curtailed in these camps by the government on unspecified security grounds, so volunteers have resorted to spreading the message by megaphone.
For the 1 million or so Rohingya refugees living in southern Bangladesh, social distancing is not an option. Neither are the other measures of self-isolation and hand-washing recommended by the World Health Organization. Aid agencies fear that the cramped conditions and a lack of access to clean water and hygiene products will increase the risk of infection inside the camps.
I would be normally taking my life in my hands to be standing here in the middle of the road. The Rohingya refugees are taking shelter in their homes. This is one of the most crowded places on earth, with over 859,000 refugees living in very, very close quarters. Fortunately, there are no confirmed cases yet in the settlements, but we do have the sense that it's only a matter of time, and that's why we're working as fast as we can to put the preparations in place that will allow us to respond.
Death stalked the Rohingya people in the pre-corona era. They're used to it. They're resilient but very vulnerable and hopelessly ill-equipped to cope if, or more likely when, COVID-19 strikes.